1 in 4, that's the number. 1 in 4 adults over the age of 65 will fall this year. And I am telling you, the number one hidden culprit is not their eyesight, it's not their balance alone. It is the very medication they trust to keep them healthy.
That's Dr. Marcus Evans, a leading expert in geriatric health. And that statistic is the entire reason we are having this conversation today. Welcome to the Essential Health Podcast. I'm Dr. Anya, and that number is terrifying. We think of falls as accidents, but what you're saying is that many are preventable side effects.
They are. The data is undeniable. Up to 40% of fall-related hospitalizations in seniors are directly linked to medications that impair stability. We are talking about dizziness, muscle weakness, and a loss of coordination caused by the most common prescriptions in the world. This is a massive and largely silent public health crisis.
And that is our promise to you today. This episode is a public service announcement. We're going to open up that medicine cabinet and expose the hidden dangers. Dr. Evans is going to walk us through 10 common types of medication that can secretly make you lose your balance. He's going to explain why they have this effect, and most importantly, we will end with a clear, proactive, stay steady action plan with steps you can take starting today to protect yourself.
Knowledge is stability, Anya. That's the goal.
Then let's get right to it. What is the first category of medication we need to be aware of?
Let's start with the category that has the most direct and, frankly, obvious impact on our brain's processing speed and alertness. These are the medications that are designed to slow things down. I'm talking about sleep aids.
This is a huge one. Millions of people, especially in our age group, turn to medications like Ambien, Lunesta, or even simple over-the-counter options like Benadryl or Tylenol PM to get a good night's sleep.
Exactly. And while they may be effective at helping you fall asleep, the problem is that their effects don't just magically switch off the moment you wake up. These drugs work by slowing down your overall brain activity. And that slowing effect can persist for hours into the next morning, creating what we call a hangover effect. You may be awake, but your brain is still in a fog. Your coordination is impaired, your reaction time is slower, and your balance is compromised. I had a patient, a 72-year-old woman, who fell and broke her wrist. She was adamant that she hadn't tripped on anything. After a long conversation, we discovered the culprit. She had been taking an over-the-counter nighttime pain reliever every night, which contained a powerful antihistamine called diphenhydramine. That groggy, unsteady feeling she had in the morning was the direct cause of her fall. She was, in a sense, trying to walk while her brain was still half asleep.
And this risk is even higher for those middle-of-the-night bathroom trips, isn't it? When you're in a dark room and already disoriented?
It's a recipe for disaster. Getting up in the dark with a sedating medication still in your system is one of the highest risk situations for a serious fall. My advice is always to explore non-pharmacological options first. Good sleep hygiene, a consistent sleep schedule, reducing screen time. And if you absolutely must use a sleep aid, you and your doctor need to have a serious conversation about the lowest possible effective dose and be incredibly cautious about your movements in the morning.
That's a very clear warning. What is the next category of brain-acting medications that can cause similar problems?
The next is a very close cousin, anti-anxiety medications. Specifically the class of drugs known as benzodiazepines. These are household names: Xanax, Valium, Ativan. They are widely prescribed for anxiety and panic disorders.
And they are incredibly effective for many people. What is the mechanism that puts our balance at risk?
They work by enhancing the effects of a neurotransmitter in the brain called GABA. GABA is your brain's primary brake pedal. It induces calmness by slowing down nerve signals. But that brake pedal doesn't just slow down anxious thoughts, it slows down everything. It causes drowsiness, dizziness, and crucially, it causes muscle relaxation. Your ability to stay balanced depends on a constant, lightning-fast communication between your brain and the tiny stabilizing muscles in your legs and core. Benzodiazepines slow down that communication and relax those very muscles. Your ability to make those tiny, instantaneous corrections to stay upright is significantly impaired.
So the very thing that's calming your mind is also calming the muscles you need to stay stable.
Precisely. And the data here is not subtle. The research is overwhelming. Older adults taking benzodiazepines are at least 50% more likely to experience falls and serious fractures compared to those who don't. And it's not just about age. Anyone using these medications, especially if they are mixed with other sedatives like alcohol or painkillers, will experience impaired coordination and a higher risk of losing their balance. Again, the conversation with your doctor should be about finding the absolute lowest dose that provides a therapeutic benefit or exploring alternative, non-sedating treatments for anxiety.
Dr. Evans, you've just given us a crucial warning about the sedative effects of sleep aids and anti-anxiety medications. I want to move on to another massive category of drugs that millions of people rely on for their mental well-being, and that's antidepressants. This is a sensitive topic because these medications are life-saving for so many. How do they fit into this conversation about balance and fall risk?
It is a very sensitive topic, and I want to start by saying that mental health is just as important as physical health. No one should ever stop taking an antidepressant without a deep conversation with their doctor. That being said, it is a medical fact that certain classes of these drugs can and do increase the risk of instability, but through a variety of different and sometimes surprising mechanisms. Let's talk about the most common classes, the SSRIs like Prozac and Zoloft, and the SNRIs like Effexor. These drugs work by affecting serotonin levels, which is great for mood. But serotonin doesn't just work in the brain, it also has effects on blood vessel function. In some individuals, this can lead to changes in blood pressure or, in rare cases, irregular heart rhythms, both of which can cause a feeling of dizziness or lightheadedness.
And what about the older classes of antidepressants?
The older class, the tricyclic antidepressants like amitriptyline, carry a more direct and well-known risk. They are notorious for causing that dangerous drop in blood pressure when you stand up too quickly, orthostatic hypotension. A person can feel perfectly fine while sitting, but when they stand up, the blood pressure plummets, blood flow to the brain is momentarily reduced, and they can feel incredibly dizzy or even faint. For a senior, a sudden faint is a direct path to a fall. I had a patient, a lovely gentleman who had been on a tricyclic antidepressant for years. He came to me after a series of minor falls that he couldn't explain. We monitored his blood pressure, and sure enough, every time he stood up, it would drop precipitously. We worked with his psychiatrist to slowly transition him to a newer class of medication with a lower risk profile for this side effect. The fall stopped completely. He was treating his depression just as effectively, but now he was doing it safely.
So the message isn't to stop treating the depression, it's to be aware of these potential side effects and to have an open conversation with your doctor about finding the safest possible option for your specific physiology.
That is the perfect summary. It's about personalized, risk-aware medicine. The benefits must always outweigh the risks.
Let's move to our final category in this brain-acting group. This one is complex because the disease itself causes balance problems, but you're saying the medications can sometimes make it worse? Let's talk about Parkinson's medications.
This is one of the great paradoxes in geriatric medicine. Parkinson's disease itself affects movement and coordination. The medications we prescribe are designed to improve that movement. But those same drugs can have side effects that significantly impact balance and increase the risk of falls. Let's take the most common Parkinson's medication, levodopa. Its job is to replenish dopamine in the brain, which is fantastic for improving things like tremors and stiffness. However, it can also cause significant orthostatic hypotension, that same sudden drop in blood pressure when standing up too quickly. Studies suggest that up to half of all people with Parkinson's on this medication experience this side effect. So the drug that helps them walk more smoothly can also make them feel incredibly dizzy the moment they stand up to start walking.
That's a clinical catch-22. Are there other classes of Parkinson drugs with similar risks?
Yes, the other major class, the dopamine agonists like Maripax or Requip, can also affect balance in a different way. They can cause profound drowsiness, dizziness, and even sudden, unpredictable sleep episodes. This makes any activity that requires balance, like walking or even just standing, potentially hazardous. Then there are the anticholinergic drugs used for tremors, which can cause confusion and blurred vision. You can see how this becomes a complex balancing act, pun intended. For the physician, we are constantly weighing the benefits for movement against the risks for stability.
So, for anyone listening who is living with Parkinson's or is caring for a loved one with the disease, what is the key takeaway?
The key is communication and vigilance. You must be in constant conversation with your neurologist. If you or your loved one are experiencing frequent dizziness or falls, it is not just the Parkinson's. It could be the medication, and there may be adjustments in dosage, timing, or the type of drug that can make a profound difference in safety and quality of life.
Dr. Evans, we've just spent a significant amount of time in the brain discussing the medications that can slow our processing and affect our mood and movement. Now I want to shift our focus to the rest of the body, to the medications that manage our core internal systems. And I think we have to start with what is arguably the most common category of prescriptions for people over 60, blood pressure medications. These drugs are absolute lifesavers. They prevent heart attacks, strokes, but you're saying they come with a hidden risk to our stability?
They are unquestionably life-saving, Anya, and I want to stress that. But yes, the very mechanism that makes them so effective at lowering blood pressure can also, if not perfectly calibrated, lead to dizziness, lightheadedness, and an increased risk of falls. A major study in the Journal of the American Geriatric Society found that older adults taking these medications had up to a 30% higher risk of serious falls. We need to understand why so we can be smarter about how we use them. Let's break down the main classes. First, you have the beta blockers like metoprolol. Their job is to slow down your heart rate. By doing so, they reduce the force of the blood pumping through your system, which lowers your pressure. But what happens if that heart rate is slowed down a little too much? You can feel fatigued, and when you stand up quickly, your heart can't speed up fast enough to pump blood to your brain, leading to that feeling of lightheadedness.
Okay, so beta blockers affect the pump itself. What about the next big category, the diuretics or water pills?
Diuretics like hydrochlorothiazide work by telling your kidneys to flush out excess sodium and water from your body. This reduces the total volume of fluid in your plumbing, which lowers your pressure. It's a very effective mechanism. However, there are two potential downsides. First, if you flush out too much fluid, you can become dehydrated, which on its own can make you feel weak and dizzy. Second, as you're flushing out sodium and water, you can also accidentally flush out too much of other essential electrolytes like potassium and sodium. An imbalance in these minerals is a direct cause of muscle weakness, leg cramps, and coordination problems, all of which make falls more likely.
So the very drug that's helping our heart could be indirectly weakening the muscles we need to stay upright. That's a crucial connection. And the third major class.
The third are the ACE inhibitors like lisinopril. They work by relaxing and widening the blood vessels themselves. But for some people, especially when they first start the medication or if the dose is too high, this relaxation can be too abrupt. They can cause sudden sharp drops in blood pressure, particularly that classic orthostatic hypotension when getting out of bed in the morning. The key here, and for all blood pressure medications, is communication. Regular blood pressure monitoring at home, staying hydrated, and standing up slowly are vital. If dizziness is a frequent problem, it's not something to just live with. It's a sign that a dosage adjustment may be needed.
That is so important. Dizziness is a piece of data, not a life sentence. Let's move to the other massive category of systemic drugs, diabetes medications. How do they fit into this picture?
Well, some of the newer diabetes drugs can cause dehydration. The primary and most dangerous risk for balance is hypoglycemia, or dangerously low blood sugar.
This is especially true for patients who use insulin and a class of oral medications called sulfonylureas. These drugs are designed to lower your blood glucose, but if the dose is too high or you take the medication and then skip a meal, your blood sugar can drop too low. And we have to remember, what is the primary fuel for your brain? Glucose. When your brain is starved of its fuel, it cannot function properly. The symptoms are immediate and severe: blurred vision, confusion, shakiness, profound weakness, and even fainting, all of which dramatically increase the risk of a fall.
And this is not a rare occurrence,
Not
is it?
at all. Studies show that up to 25% of all emergency room visits for hypoglycemia are in people taking these medications. The solution is vigilance. If you are on these medications, you must monitor your blood sugar regularly. You must know the early warning signs of a low, the shakiness, the sweating, the confusion, and you must always have a source of fast-acting glucose with you. It's about respecting the power of the medication you are taking and having a safety plan in place.
Dr. Evans, we've covered the major categories of long-term medications for chronic conditions. But now I want to turn to the drugs that we think of as more temporary or even harmless, the things we take for a headache, a cold, or a short-term infection. Let's start with a category that is in almost every single home in the world: pain medications.
This is a huge and often underestimated category, and we have to divide it into two groups. First, let's talk about the opioids, drugs like hydrocodone, oxycodone, and morphine. These are powerful and necessary for managing severe pain, but their primary mechanism of action is to depress the central nervous system. They work by altering pain perception in the brain, but that same action leads directly to dizziness, drowsiness, and impaired motor control. The data here is stark. A study in the Journal of the American Geriatric Society found that opioid use in older adults is linked to a staggering 68% increased risk of falls and fractures.
68%, that's a massive number. It's not a small side effect. It's a major clinical risk.
It is a major risk. And it's compounded by the fact that they can also cause low blood pressure, adding that orthostatic hypotension danger on top of the sedation. The key message for anyone taking a prescribed opioid is to be incredibly cautious with movement, to avoid combining them with any other sedative like alcohol or sleep aids, and to work with your doctor to use the lowest effective dose for the shortest possible time.
Okay, that's clear for the prescription opioids. But what about the over-the-counter drugs we all reach for, like ibuprofen or naproxen, the NSAIDs?
It's a much lower risk, of course, but it's not zero. For some individuals, particularly those with sensitive stomachs or those who are already on blood pressure medication, NSAIDs can cause dizziness or lightheadedness. In higher doses, they can also affect kidney function, which can lead to fluid imbalances that contribute to that unsteady feeling. It's a reminder that even common drugs are still powerful chemicals that we need to respect.
Let's move to another incredibly common category: antihistamines. We take them for allergies, for colds, but they're notorious for that drowsy feeling.
They are, and we need to differentiate between the generations of these drugs. The first-generation antihistamines are the main culprits. This is your classic diphenhydramine, the active ingredient in Benadryl. These drugs are very effective at blocking histamine, but they readily cross the blood-brain barrier and affect the central nervous system. This is what leads to their powerful sedative effects, drowsiness, dizziness, and significantly slower reaction times.
And this is the same ingredient we find in many over-the-counter sleep aids, like Tylenol PM, which connects back to our first category.
Exactly. It's often the same drug marketed for a different purpose. The Journal of the American Medical Association found that older adults taking these first-generation antihistamines had a 20 to 30% increased risk of falls simply due to these sedative effects. They can also cause blurred vision, which makes it easier to misjudge a step or an obstacle. The second-generation antihistamines, like Claritin Resurtec, are designed to be less sedating because they don't cross the blood-brain barrier as easily, but they can still cause dizziness in some sensitive individuals. The safest approach is to always opt for the non-drowsy versions when possible.
This is all so interconnected. It seems the main theme is sedation equals risk. Now, there's one final category on your list that I think will truly shock our listeners because it's a type of medication we think of as purely for fighting infections with no connection to balance at all.
This is the one that often surprises my medical students the most. It's certain types of antibiotics.
And how in the world can an antibiotic make you fall?
Through a very specific and serious mechanism called ototoxicity. Oto refers to the ear. Certain powerful classes of antibiotics, particularly a group called aminoglycosides, that are often used in hospital settings for serious infections, can be toxic to the delicate structures of the inner ear. The inner ear is the home of your vestibular system, the gyroscope that is absolutely crucial for your sense of balance. Studies suggest that a significant percentage of patients treated with these specific antibiotics can experience vestibular toxicity, leading to dizziness, a persistent sense of unsteadiness, and in some tragic cases, permanent balance problems. These drugs can literally damage the nerve that sends balance signals from your inner ear to your brain. While this is a less common risk than, say, the side effects from blood pressure medication, it is far more severe when it happens. The key takeaway is simply this. If you are ever on a course of antibiotics and you suddenly begin to experience severe dizziness or a new problem with your balance, you must inform your doctor immediately. It could be a sign that a change in medication is needed to protect your hearing and your balance.
Dr. Evans, this has been an incredibly eye-opening and, I'll be honest, slightly terrifying journey through the modern medicine cabinet. We've talked about so many common medications that carry this hidden risk to our stability. I'm sure many people listening right now are looking at their own prescriptions with a new sense of concern. So let's spend the rest of our time together in the most important place, the solution. Let's pivot from the problem to the plan. What is the first, most critical step someone should take if they're experiencing dizziness or balance issues and suspect their medication might be the cause?
The first step is the most important, and it is non-negotiable. You must open a conversation with your healthcare team. This means your primary doctor and, just as importantly, your pharmacist. I want to be crystal clear with everyone listening. You should never, ever stop taking a prescribed medication on your own. These drugs are often life-saving. The goal is not to stop the medication. The goal is to optimize it. Your pharmacist is an incredible, underutilized resource. They are the true experts on drug interactions and side effects. Go to them with a list of everything you take, prescriptions, over-the-counter drugs, even supplements, and ask them, could any of these, or the combination of them, be causing dizziness? Then, armed with that information, you go to your doctor. The conversation is simple. Doctor, I am experiencing frequent dizziness and I'm concerned about my fall risk. My pharmacist and I reviewed my list and we think it might be related to my blood pressure medication or sleep aid. Can we discuss my dosage? Are there any alternative medications in the same class that are known to have a lower risk of this particular side effect?
That is such an empowering script. You're not making a demand. You're opening a collaborative conversation. You're becoming a partner in your own healthcare, not just a passive recipient of a prescription.
That is the entire goal. This is about partnership. So often, a simple adjustment, a slightly lower dose, or switching from a tricyclic antidepressant to an SSRI, for example, can completely resolve the issue while still effectively treating the underlying condition.
Okay, so step one is the essential conversation. Once that's in motion, what are the immediate behavioral changes we can make to keep ourselves safe day to day?
These are the simple habits that can dramatically reduce your risk. The first is almost too simple, but it is profoundly effective. Stay hydrated. Dehydration thickens your blood, lowers your blood pressure, and can on its own cause dizziness. When you combine that with a medication like a diuretic or a blood pressure pill, it's a perfect storm. Sipping water consistently throughout the day is a foundational safety measure.
The second, and we've mentioned this a few times, is to stand up slowly. That sudden drop in blood pressure, orthostatic hypotension, is a mechanical problem. You can outsmart it by simply refusing to be in a hurry. When you get out of bed, don't just spring up. Sit on the edge of the bed for a full 30 seconds. Let your body and your blood pressure adjust. Then stand up slowly, perhaps holding on to the nightstand. The same goes for getting up from a deep, comfortable chair. A simple pause can be the difference between a dizzy spell and a stable transition.
Those are brilliant, easy to implement habits. Now let's talk about the more long-term, proactive work. How can we fortify our bodies and our environment to be more resilient against falls?
This is where we move from defense to offense. First, fall-proof your home. Take an honest walk through your house as if you were seeing it for the first time. Are there loose rugs waiting to trip you up? Is there clutter in the walkways? Are the stairs well lit? Are there grab bars in the bathroom? These are simple environmental changes that can remove the most common hazards. Second, you must actively build your strength and balance. A body with strong leg muscles and a well-trained sense of balance is far more capable of catching itself during a moment of dizziness. You don't need intense exercise. In fact, gentle, focused practices are often better. Tai Chi is one of the most well-researched and proven forms of exercise for improving balance and reducing fall risk in seniors. Gentle yoga, which focuses on core strength and stability, is also fantastic. The goal is to consistently practice standing on one leg, shifting your weight, and strengthening the muscles that keep you steady.
And the final piece of this action plan.
The final piece is to use assistive devices without shame. If a cane or a walker allows you to move through the world safely and confidently, then it is not a sign of weakness. It is a tool of empowerment. It is a symbol of your commitment to staying active and independent. The stigma around these devices is a dangerous barrier that we must dismantle. Using a cane is infinitely better than suffering a hip fracture that could rob you of your independence for good.
Dr. Evans, thank you. You've taken a topic that is full of fear and confusion and transformed it into a clear, manageable, and hopeful action plan. The core message I'm taking away from this is one of empowerment. This is not about being afraid of our medications. It's about becoming informed, active partners in our own healthcare.
That's it exactly, Anya. Knowledge is stability. Understanding that a side effect is just a piece of data allows you to have a productive conversation with your doctor. It allows you to take these simple, proactive steps to stay safe and steady on your feet, so you can continue to live a full and active life. That's the entire goal.
A perfect final thought. And to our incredible community listening, now it is your turn. We want to hear from you. After this eye-opening conversation, which of these common medications surprised you the most to learn it could affect your balance? Please share your answer in the comments below. Your aha moment could be the very thing that helps someone else in this community connect the dots. If you found this conversation valuable, please show your support by giving us a like. It truly helps our podcast reach more people who need to hear this information. And be sure to subscribe to the Essential Health Podcast so you never miss a conversation. Thank you so much for being here with us. Until next time, stay safe and stay balanced.